name is Leanne, and I'm going to be doing a health assessment with you today and talking about your recent diagnosis. It is my understanding that you had a recent diagnosis of beginning stages of COPD recently.
Yes.
And that was with your primary physician and a pulmonologist that you saw in the last 2 weeks?
Yes.
Okay. So you had some problems, trouble breathing, trouble sleeping, went in and got put on some antibiotics for pneumonia, and that didn't cure all the symptoms, so they referred you to the pulmonologist, and that's where you got the diagnosis?
Mm-hmm.
Okay. So a few questions about yourself. What's your occupation?
I'm a truck driver.
Okay. Do you do over the road or in town?
Over the road.
Okay. And what do you deliver?
Roof trusses.
Okay. Are you a smoker?
Yes, ma'am.
Okay. How much do you smoke a day?
2.5 packs.
Okay. About how long have you been smoking?
About 20-some years.
Okay. All right. Any other health problems that you know of that you've had in the past?
No.
No? Okay. Any medications that you take?
No.
No? Okay. Let's talk a little bit about your family history. Are both of your parents living?
Yep.
Okay. Are they smokers?
Yep.
Okay. Do they have any diseases, or have they had any health history?
Yep. Breast cancer.
Okay. And your mother, was that a long time ago when you were little or recent?
That was a long time ago.
Okay. And how about your dad?
He's got the same thing.
The COPD?
Mm-hmm.
Okay. Does he use any inhalers or anything that you know of?
Yes, ma'am.
Okay. How about your siblings? Are they alive and well?
Mm-hmm.
Okay. So as far as your family history goes, it does run in your family. Were your parents smokers when you were little?
Mm-hmm.
Okay. So you were exposed to secondhand smoke as a child? Okay. Are you exposed to any sort of dust or chemicals, anything like that while you're at work?
Maybe dust.
Maybe dust, like some sawdust?
Yeah.
Okay. Does your semi have lots of fumes, or is it?
Mm-mm.
No, not really. Okay, good. All right. Well, what I want to do today is I want to do an assessment on you, kind of check you out head to toe, see if there's any symptoms that I can find. Then we'll go over some symptoms that you've been having. We'll talk about what we need to do to help you to quit smoking and also help you to have the COPD kind of come to a halt. It is non-reversible, but we can try to make it the progression of it stop. So what I'm going to do first is I'm going to do a set of vital signs on you, and then I'll do a quick assessment.
Mm-hmm.
All right, so first off, I want to do a blood pressure. Have you ever been told you had high blood pressure?
No. I don't think so.
Get that thing to stay. Okay, so we're at 160 over 80, which isn't too bad, but just slightly high. And I also want to do this right here, monitors the level of oxygen in your blood. And at a later point throughout one of our visits, we will do what's called a resting exercise. So a respiratory therapist will come in and kind of do some exercises with you while they have one of these hooked to your finger to see how you do with your oxygen while you are doing exercise.
That's good.
All right, so we're right now at rest. We are at 94%, which is great, and your pulse is at 91. So, getting towards the high side, but still in the normal range. So that all looks good. And like I said, we will test your exercise and see how your oxygenation goes. I do want to take a listen to you. Sneak right here. All right, you can just breathe normal. I'm going to listen to your heart. Okay, I'm going to have you lean forward, and we'll do some deep breaths. One more. All right, I'm going to have you lean back. I'm just going to listen to your belly. Any pain with deep breaths? Nope. Any pain in your belly? All right. Pulse this here. Have you ever noticed any swelling in your legs or your ankles?
Not that I know of.
Okay. Look good now. No swelling. Good pulses. All right. The only things that I have, that I noticed was your breathing, your lung sounds were a little diminished, and also some like crackles, which is pretty common for people who smoke. It's just kind of showing that there is some damage to your lungs, which is kind of goes along with what the pulmonologist said. So, a few questions about any symptoms you've been having. So, have you been having any neurological deficits? Anything in your head that you notice numbness or tingling in any of your limbs, or periods where you can't talk or express what you want to say?
No.
Nope. Okay, good, good. How about any chest pain?
No.
No? How about, have you noticed that your heart has ever been racing or thumping really hard?
Yep.
Yep. Now, is that mostly with activity or with activity and rest?
Activity.
Activity? Okay. Does it happen almost every time?
Mm-hmm.
Okay, every time you kind of exert yourself?
Yep.
Okay. All right. As for your breathing, so you did mention that you had some shortness of breath with activity. Have you noticed anything else? Any pain when you breathe? Any pain with the deep breaths?
Nope. Just
Nope.
shortage.
Okay. Have you had any shortness of breath at rest when you're not really doing anything?
No.
No? Just anytime you go to do some activity. Okay. All right. So have you had any digestive problems? Anything with your belly going on? Any sort of acid reflux or?
Yep.
Yep. Lots of acid reflux. Okay. What do you typically do for that?
Tums.
Tums? Okay. All right. Any problems with your muscles, like muscle fatigue, where you just feel that they're sore and they're tired quicker than normal, or that you're just having trouble kind of keeping up?
A little bit.
A little bit? Okay. All right. Let's talk about any problems with urinating.
No.
Nope. Okay. How about any issues with your skin? You said you hadn't had any swelling in your legs or feet. Any swelling anywhere or anything you've noticed?
Mm-mm.
Nope. Good. Good. All right. A few other things that I want to talk about is, the severity of the COPD. So have you continued to smoke?
Yes.
Okay. It says in your record here that they prescribed you some Chantix. Have you been taking that?
Yep.
Okay, and with no relief, no craving
Nope.
control or anything like that? Okay. So, what we want to do is try to get you hooked up with maybe some sort of support or maybe some other options that might work better for you. Do you find that there's a period in the day where you want to smoke more than others?
Yeah.
Yeah? So when are the times when you feel like the cravings are just, there's no way that I could not do that?
In the morning.
In the morning? Okay. All right. And so you're allowed to smoke in your semi?
Mm-hmm.
In your truck? Okay. So there really hasn't been, any reason for you to not smoke while you're going down the road. That probably contributes to how much you smoke?
Correct.
Okay. All right. Well, I'd like to talk to you about some support groups. There is here in South Dakota, the South Dakota Quit Line. They do offer tons of information and support to you. And then let's talk about your family. Is your family near?
Yes.
Okay. Do any of them currently smoke?
Nope.
Nope. Okay. So do you consider them to be a good support system when you're having problems with anything?
Oh yeah.
Yeah, okay, good. So you kind of have a strong family bond. So you could lean on them for some support if you kind of express to them the importance of this, and maybe they can kind of help you through, or you could
Mhm.
chat with them on the phone when you're wanting to have a cigarette, well, hands free, of course, in your semi, and
Mhm.
things like that. Maybe you could try some tricks like that. Okay. Let's see. How about social? I know that a lot of times things are hard when you're out in a social environment to not smoke. Is there certain places that are a trigger?
The bar.
The bar. Okay. All right. So even with the ban on the smoking indoors, it's still hard because
Mhm.
other people there are doing it, or when it goes along with consuming alcohol.
Mhm.
Right. Okay. All right. So maybe we can talk about a few things to eliminate that also. So, one other suggestion that we always bring up are, there's all kinds of holistic ways out there. There's herbal supplements and things like that that you can go through. If that's anything of interest to you, I can certainly point you in the right direction. Or we can just talk about the prescriptions and medical things and support groups that we can guide you towards.
Sounds good.
All right. So a lot of things that we've covered have been kind of about your health history, so we should talk about your future. So your COPD is not reversible. So smoking is the number one cause for COPD, and if you continue to smoke, it's only going to get worse. It's not going to get better. So my goal for you is to be able to stop the progression of the COPD and teach you how to maintain the symptoms that you already have, and get a little stronger from there. So um, we do have some other medication options besides the Chantix. Would that be something that maybe you would be interested in using?
Sure.
Sure. Okay. There's all kinds of things. There's gums and patches and e-cigarettes and things like that. So we can discuss those more in depth and kind of see if one of those would be something. We could also maybe look at a couple different ones so that you'd have some options. If one's not working, you can, just go on to the next. Maybe you can find a hobby also, like, some people eat candy or chew mints or something like that while they're getting through those cravings. Something that you could do while you were in your truck and driving down the road that could occupy your hands, or occupy that wanting to smoke. Also, like I said, there's tons and tons of support groups out there. There's things on Facebook. There's the quit lines. There, are things sponsored by the government. So maybe if you could just find a good support system, and maybe just knowing the severity of this will, kind of encourage you to have a little bit more willpower with quitting, which, is a very, very tough thing to quit. And so we just want you to be as, armed as you can to help you get through it. So, a couple other things I'd like to do. I would like you to see and go through some pulmonary rehab. Those will teach you exercises to kind of strengthen your lungs, also ways to deal with your shortness of breath and kind of work through them so that you can, continue to enjoy activities. Also, I'd like you to come in like every 3 or 4 months and do some lung function tests like you did with that pulmonologist to kind of make sure that everything is running smoothly and that things are progressing in the right direction. If you have any questions, you can always come back and ask. We can supply some inhalers if we feel like you're at that point where maybe you need some rescue inhalers when you do get short of breath. And hopefully we won't have to, but we can visit some oxygen options if that's something that you do need. And another thing to understand is that as this disease progresses, the chances of you being able to continue to drive truck are pretty slim. The DOT physicals are pretty tight, and it is a big risk to them. So, kind of another thing to maybe consider when you're wanting to try to stop smoking. So, kind of went through a lot of information, kind of threw a lot at you. Is there anything else that you want to talk about, or any questions that you have?
Nope, I think you summed it up.
All right. Well, again, we'll just, continue to see you as often as possible every few months, and we will be support for you. We'll also give you lots of information on what you can do to support. We'll try other options for the quit smoking aids and kind of see how it goes.
All right.
All right. Thank you.
Thank you, ma'am.